everyone, and thank you for coming to our page and to this little presentation. My name is Paulo Selber. I'm an orthopedic surgeon here at Columbia University at the Weinberg Family Cerebral Palsy Center. My story is that I was born in Brazil. I was trained in Brazil, became an orthopedic surgeon, and early on decided that I wanted to know about the way people walk. And that immediately took me to the world of disabilities, which is what I have been doing for the last 25 years. I'm very attached to the specialty of cerebral palsy. As I said, I'm an orthopedic surgeon, so I try to improve or help these patients, children and adults, with their orthopedic issues related to cerebral palsy and their limited abilities. I've worked in Brazil, I've worked in Australia for most of my career, and now I'm working in this big city of New York at this huge, wonderful University of Columbia at the New York Presbyterian Hospital, together with the Weinberg Family Cerebral Palsy Center, which is a really, really terrific center and a terrific idea where we try to abandon the concept of transition for children who become adults with CP, and instead the philosophy of the center is, okay, there's no transition. You're not going to go anywhere. You're going to stay with us, and we're going to care for the children and the adults, and we'll continue the care in one place, gathering as many professionals that are interested and have expertise in this area as possible, so that these patients, now adults, don't need to go anywhere else, except for perhaps physical therapy, gym exercises, and of course to have fun. Because I've been working with these people for a really long time, I have had the privilege and the honor to become partners with these families and these patients for a long time. And let me tell you, Brazilians are the same as Australians, the same as Americans, and the same as any other people on the planet, because we are actually all the same. And when parents, dedicated, loving, caring parents, have a child with a disorder like cerebral palsy, it is a challenge for them to start with. It's a big challenge to understand, to accommodate, to treat these children the best that they can. And having had the privilege, as I said, of working with these families for a long time, I started realizing that these families used to go through some stages in which they tend to have a pattern behavior, and these stages are really, really the sign to me that these parents truly care and truly love for their children. So Faces of Grief was an insight that I actually had together with this mother back in Melbourne, Australia. She's the mother of a boy with severe dystonic cerebral palsy. He's so severe that his limbs need to be strapped to the wheelchair, and nothing that we've done in terms of medical and orthopedic treatment has helped him, except for the fact that we managed to keep his hips inlocated and his spine straight. But after these and a few other interventions, this beautiful, intelligent mom comes to me and says, Paulo, I think I'm at a better place these days. And I said, well, tell me about it. And she said, well, this is what's happened to me when my son was born. Me and my family, we didn't know, we lost it. We didn't know where we were. We were in shock, like when somebody dies in your family. And then later on, I started seeing you, and you're telling me that my child had CP, and I didn't want to hear it. And then I started doing all sorts of searches, and I wanted to cure my kid. And now it feels like I'm just happy. I know that I have a child. He's a beautiful, intelligent boy. He has significant motor disability, but intellectually he's perfect. And I have had the opportunity to learn and to change myself and my family for the better. So, and I thought about it, and since that mother, I started paying attention to families and families that would come to me when their children had just been born, and families where their children were 2, 3, 4 years of age, and all ages, because I have been seeing children and adults all along. And then I started reading about this, and there is quite a bit written in other fields and in this field. And I realized that, yes, obviously, and this is so obvious now to me, remember, I'm an orthopedic surgeon, I'm not a psychiatrist, but I'm human as well. And it was so beautiful for me when I understood these phases, and because understanding them made me understand how I had to approach these children and these families primarily in different phases. And I've been talking about it for a long time, primarily in Australia and with my colleagues in Australia. And now I came to Colombia, and I started talking about it. And eventually I met the beautiful people from Kessler, which is a website from Johns Hopkins, and it's a beautiful website. And its mission is to remind us all, medical professionals or healthcare professionals, that we should be humane and that we should treat patients like Dr. or Sir Osler taught us how to do, not being machines, not being computers, but treat them as they deserve, as people just like us. So last year, they invited me, and I accepted immediately, of course, to publish a non-scientific article. This is not based on statistics or data so far. It's based on heart and impression and clinical observation for approximately 10 or 15 years. And as I said, this is not science. It hasn't come from statistics, nor has it come from p-values. It's come from human observation of humans for a long time, in someone who I want to believe that I really pay attention to these parents all the time. So anyway, I divided the phases in a simplistic way in 4 subphases or 4 stages, if you will. The first is what we call shock, and it's obvious. It's when the child is born, and a diagnosis is made. And what happens is that the family is scared. They're taken away. They are disconnected a little bit with the world, and they're trying, they're basically scared of what's going on, and they don't understand it. The second phase is when we call it denial, but you can call it other words, is when they're not accepting the fact. And that happens to all of us. And again, these phases exist because these people are humans, because these people care. If they were robots, these phases wouldn't happen. The third phase is a phase that interests me the most, and I don't really have a specific name for it. Some people have called it search for answers, or a search for cures, or for search for treatments. The problem with phase 3 is that we all have a tendency to try and want the best possible treatment with the best possible outcomes, with as little effort, or as little, effort is not the word, but as little aggressiveness as possible to the child. In phase 3, parents start searching everywhere, and they start searching these days, of course, on the internet. And on the internet, there are beautiful websites out there proposing all sorts of miraculous treatments, miracle therapies, and miracle surgeries, and miracle everything. And obviously, because these parents, they love their children and they want the best for them and the best life that they can give to these children, they go for these therapies. And many of them have no evidence behind them. And again, it's perfectly normal to go after these therapies, because if I could find something that's going to cure my child, that it's going to make my child better, and without too much intervention, that's what I want. That's what I would do for my children, myself as a father. But the problem is that a lot of these therapies, instead of helping the kids, they actually harm them more. And not to mention that many of these places harm the bank accounts of these families. And it's interesting that in phase 3, the families, it doesn't matter how close you have become to them, they feel the necessity not to tell you that they're going to go for these therapies. And usually the only professional that's related to the child and to the family that gets to know is the physical therapists, which to me is a sign of how close and the relationship between a physical therapist and the family is, and how much the families trust the physical therapies. And so should they, because physical therapists are an amazing part of the process in trying to bring these children to as much function as they can within their limitations. The problem is that in phase 3, a lot of children are damaged. And in the orthopedic field, I see it all the time, children that go through surgeries where they promise no scars, no quick recovery. And what happens is that these children are on their toes, they have bent knees, and then they go through some of these surgeries, and the next day they recover, they're not too sore, and they're not on the toes anymore, and the knees are extended. And what happened there is that some of these surgeries include cutting the muscles until those joint positions are achieved. But the truth is, we know that when we cut the muscles is what moves us. And what happens is that when children are children and little, and they don't have a lot of body mass, they don't miss those muscles too much to begin with. So the immediate results are beautiful, and the child is straight and stretched, and the parents love it, and the children didn't suffer. The problem is when you see those children 5 years later or 10 years later, or in my case as well, 30 years later, and now they're tall, they're bigger, they're heavier, and they don't have those muscles, and their function goes down as they grow older and heavier. And the parents cannot correlate what they're seeing now with their now not child anymore, adolescent or adult, and with that surgery that was done a long time ago that was actually beautiful. You know, my child was on her toes, and the next day she's flat on the floor, and it's just perfect. And I did it through no surgery, just minimally invasive surgery, as they say. So when these patients come to us later on, and they're having lots of issues, and they have gone into wearing or using crutches, whereas before they didn't use them, or they're now on wheelchairs, and they say, okay, doc, what can you do for me? And unfortunately, we can't do much because the muscles are no longer there, the muscles that were cut. So many families then, after they realize that, and this may take 5 years, 7 years, as I said, 10 years, they come to you then, and they don't feel good about what they did. And of course, this is a conversation that we never have, because they tried the best that they could to help their children. They were just misguided by the computer and the internet. And what we have to do is to try and do the best we can with those now older children, adolescents, and adults to see if we can relieve and help their quality of life. But in this phase, families is what I call phase 4. And Klossler helped me to name this phase as phase of arrival. It's called arrival because family have arrived to a point of more happiness, and they understand that they have a beautiful child. They have a human being just like anybody else, with just stubborn legs or stubborn arms, as I call them. And that we just need to do whatever we can sensibly and honestly to try and make their quality of life better without promising miracle, benign, minimally invasive treatments that we know are not always what they propose. So these 4 phases are important, and people go back and forth on those phases. And again, it's not wrong to be in any of these phases. We are there because we're humans, as parents, or as carers, as people. And I hope discussing these in open like this, this helps the patients and the parents to think about phase 3 primarily, and be careful with what they see on the internet, because not a lot of what's proposed as benign and minimally invasive and beautiful is reality in the long term. And I think these parents should look around, look to the articles, try to understand why big centers for cerebral palsy don't do certain techniques. Is it because they don't know how to do it? Not really, because in medicine we share knowledge. We share, whenever we're doing something that really works, we share it, we do research, and we publish it, and everybody starts following it. That's what medicine is all about, is to share knowledge so that more people can be treated properly and honestly, and with results that are what is possible to achieve. I wanted to emphasize again that there's a lot of literature written about phases of grief in different human situations. And POG, or phases of grief, is just an informal take on what's been written before. And I think the most important part of POG to me is phase 3, because phase 3 is where children are submitted often to unorthodox treatments that, instead of causing or instead of improving them, they actually cause harm in many instances. And in this field, it's hard because these harm often is only noticed and seen down the track, not immediately after the interventions. And often, as I said, parents cannot correlate what's happening 10 years down the track to those therapies or those surgeries that were done early on. So thank you very much for watching, for your time, and I hope this little presentation has at least triggered some ideas and thoughts in all of you. Thank you so much. Bye-bye.